Good evening, everyone. Good evening, everyone. This is Dr. Famuyiwa with another episode of Fertile Talks. So, today I want to talk about something that's rarely talked about, and that is what some women have had to go through a phenomenon that some have called flooding, right? Flooding, which they mean by that heavy menstrual cycles with that involves bleeding through their menstrual pads, bleeding through passing huge clots. For some people, they have actually normalized this. But what if I told you that in rare cases, this can actually become life threatening? And more importantly, how do you know when heavy bleeding is not just inconvenience and when it's actually dangerous, right? So that's what we're going to break down for you today. Let me start with a real clinical scenario. So, a patient had been experiencing very heavy menstrual cycles for some time, the kind where she soaks through pads and passes clots, and she had adapted to it. One night, after an exhausting day at work, she went to sleep, and her period started overnight. By the time her family found her the next morning, she had lost a significant amount of blood. That outcome is extremely rare. It doesn't happen usually, but it's not theoretical, right? And this is where we need to be very, very precise. Heavy menstrual bleeding, medically called abnormal uterine bleeding, is common. Up to about 1 in 3 women will experience this at some point. However, severe life-threatening hemorrhage from menstruation is uncommon. So the goal is not fear, the goal is actually recognition. What is normal versus abnormal, for instance? Normal menstrual bleeding typically involves bleeding lasting 4 to 7 days, like changing your pads or tampons every few hours, but not every hour, and involves minimal or small clots. The red flags that require evaluation would be soaking through a pad or tampon every 1 to 2 hours, bleeding that runs down your legs, passing large clots repeatedly, bleeding that lasts more than 7 days, symptoms of chronic anemia such as fatigue, dizziness, shortness of breath. So if you are having any of this and thinking, that sounds like me, this is not something to normalize. The most common causes of heavy bleeding like that can fall under a structural framework we use clinically, such as fibroids. Adenomyosis is when endometriosis exists in the uterus. And I've done a video on endometriosis in the past. If you want to go look at it. That's imagine when you have a menstrual efflux, right? When you have your period and it comes out of your body. Imagine that instead going back into the body. And in this case, if it goes into the uterus, it's called adenomyosis and can cause heavy bleeding. Ovulatory problems, such as some patients see in PCO patients, if they're not ovulating regularly, they're not having regular withdrawal bleeds, that can cause heavy bleeding. Bleeding problems. I also did another video on von Willebrand's and also bleeding disorders. You might want to look through my YouTube channel. That can cause it. Endometrial hyperplasia, endometrial cancer, um, now, important nuance here, endometrial cancer is not the most common cause, especially for younger women. It's just that it's a critical diagnosis that we do not want to miss, particularly in women with risk factors such as obesity, PCO, or chronic anovulation. So, before we continue, let me say this clearly. If you are experiencing heavy bleeding and you are not sure what is causing it, you should be evaluated. So, why would patients delay? Um, Now, let's address some of the things that are important here. Many patients do not seek care, not because they did not notice the symptoms, but because they've normalized it in their families and their communities, and they think flogging or clotting or whatever they call it is just normal, and it's not. Prior negative experiences with the medical field, and they feel, well, gee, that doctor didn't listen to me or didn't care about me, or they just want to rush me to the surgery. They're not really hearing me out, so they don't go. Financial barriers, maybe lack of insurance. All those concerns are real, they're genuine, they're people's lived experiences. And some clinicians may move quickly to procedures such as surgery, but the alternative of ignoring severe bleeding carries its own risk, such as progressive anemia, iron deficiency anemia, affecting ovulation, pregnancy outcome, and in rare cases, acute hemorrhage, like it happened to this patient. So this decision really is not between nothing and surgery. It's really a spectrum of evaluation and treatment options. And I think you need to be seen and evaluated. What a proper evaluation should include will be a detailed menstrual history, ultrasound imaging, laboratory testing for to see if you're anemic, hormonal profile, endometrial sampling when needed. And then treatment really depends on what's causing it. Is it hormonal treatment needed? Is it non-hormonal treatment needed? Does it involve a minimally invasive procedure? And surgery when actually indicated and necessary. So the key takeaway here is flooding is not diagnosis. It is a symptom, right? And symptoms are signals that something is off. The goal is not to tolerate them. The goal is to understand what's going on with your body. Okay. So if you're experiencing heavy bleeding, soaking through pads, or feeling the effects of anemia, I strongly encourage you to seek care. If you schedule a consultation with your family doctor, your primary care doctor, your gynecologist, they can guide you in the best way to go. So before we close, I want to ask you a small favor. Right now, many of you listening to this have not yet subscribed to our YouTube channel. And when you subscribe, when you click that button, it actually helps us because the algorithm recognizes that. So I encourage you, before you leave today, just click that button and share this episode with your friends. On another note, my book, The Quest for Fertility, is now available for pre-order. You can look it up on Amazon. Go to my website, get a link if you don't. I'm so super proud of all of you who have expressed an interest. So go ahead and get your pre-order signed in. Thank you once more. This is Dr. Famuyiwa.